on this on Thursday, okay? So hopefully you've already read the PowerPoint. Kind of, sort of, maybe? Yeah? All right. So a couple things, we're gonna start out with the location of the heart. I want you to know that it lies in the mediastinum. Okay, so you wanna highlight that in your notes. It lies in the mediastinum, behind the body of the sternum, between the points of attachment of ribs 2 through 6. Approximately 2/3 of the heart's mass is to the left of the midline, and 1/3 is to the right. I want you to think of the heart as a 4-chambered muscular organ. It's like a pump, and it's the size of a closed fist. It's the size of a closed fist. Sometimes our patients can have what we call cardiomegaly, and that's an enlarged heart. Why do you think a patient would have an enlarged heart? What are some of the reasons? Good, yeah. If they had a couple heart attacks, that could enlarge the heart. What else?
Fluid trapped in the pericardial sac.
Yes, fluid that's trapped in that pericardial sac can actually cause the heart to enlarge.
Is it a genetic thing?
And could, yes, absolutely, could be genetic, could be drug related. Steroids have been known to cause the heart to enlarge. So the first thing I want you to notice about the heart is the apex. And if you remember from last semester, apical or apex means the most narrow part of the heart. And that's right here, or I'm sorry, it means the most narrow part of the organ. And with the heart, it's right here. You see how it comes into a point? That's the apex. The other thing that you want to know about this apex is that it always points to the left side of the heart. So I think you remember me telling you that exam number 5, which is your last regular exam in here before the final, I'm going to test you on parts of the heart and parts of the cat. So for exam number 5, I may have a picture with of the heart with an arrow pointing to the apex, and it's multiple choice. You know, it's very, very easy if you pay attention to lab. And you can videotape my dissection when I do it. I'm gonna come around and test you, and you can videotape that. You can take pictures. I try to make your last regular exam very fair, so that you can get a really good grade going into the final. It'll bring up your grade a few points, and you know, especially if you're struggling with it, it really helps. Okay, so this is the apex, and this is going to be the base. The base of the heart is what base means. It's the widest part of the heart. So that's going to be on the top here, or the widest part of any organ. And for the heart, it's right here. When we do respiratory, you're going to see it's just the opposite. The apex is actually on top, and the base is actually on the bottom when we talk about lungs. But for the heart, the apex is on the bottom, and the base is at the top. I want you to know that the apex actually rests on the diaphragm. It actually rests on the diaphragm. This is why my nurses, at Thanksgiving, when you kind of overeat, sometimes you feel some chest pain, right? And shortness of breath. Well, that's because your stomach expands, and when it expands, it pushes up against that diaphragm, and of course, the apex of the heart is right there on that diaphragm. So it causes you to have shortness of breath and sometimes chest pain. The upper border of the heart, the base, lies just below the second rib. Okay, and this is your base. The boundaries of the heart are clinically important because a marked increase in size can indicate certain types of disease. And sometimes we find this out by accident. Like a patient could come in and let's say they have a respiratory infection, and we take x-rays of their lungs, and then we look at the x-rays and say, oh my goodness, they have an enlarged heart. So sometimes we find it by accident. This is what the heart, again, it should be the size of a fist. This would be cardiomegaly. The heart's enlarged. This is a nice visual of where the heart is located. And of course you see the apex is actually touching the diaphragm here. Do you remember what nerve innervates the diaphragm? Yes, the phrenic nerve. Excellent, the phrenic nerve. And where does that originate? All the way up in the cervical plexus, in the neck. On slide 7, I just want you to be aware that between puberty and the age of 25, the heart attains its adult shape and weight. In adults, the shape of the heart tends to resemble that of the chest. But it takes about 25 years for the heart to fully attain its adult shape and weight. The heart weighs 310 grams in men and 225 in women. And of course, that's an average. So when you have your exam number 5, exam number 5, I'm going to take pictures from the actual hearts that we dissect and from this heart model. And this heart model is identical to this one. The reason I'm going to use the model is because there's some structures that you can't see on the little sheep hearts. Okay? So I'm going to point those out to you now. Here we have the aorta, which you definitely will be able to see on the sheep heart. But what you won't be able to see is the branches coming off of the aorta. So this one is referred to as the brachiocephalic trunk. I want you to be able to identify that on this heart model.
Sorry.
So all you have to remember, because you want to have a landmark, the superior vena cava is right here, and this heart that I'm holding, this is the superior vena cava, it's in blue. So what's the first branch off the aorta? The brachiocephalic. And then in the middle is going to be the left common carotid artery. And just remember that that's in the middle. And then the next one is going to be the left subclavian artery. Okay, so I want you to know those 3 branches coming off the aorta. And I'm actually going to show you the pulmonary trunk on the sheep hearts, and I'll show you how to identify those. Okay. The rest I think we will be able to see on the sheep hearts. Okay, let's talk about the coverings of the heart. the first thing I want you to know about the heart is that it lies in a pericardial sac. It almost resembles like a bag, if you will. Pericardial sac, it's very loose fitting. So if this was a real heart, you would actually, before you dissected it, you would actually take it out of that pericardial sac. Okay. Unfortunately, the hearts in the lab, they were already removed when they prepared them for dissection. Yes?
It's a random question, but when they do like transplants, do they take them out?
Mm-hmm.
Yeah, they take them out.
Well, they take the whole heart out and then they
It
replace.
stays in the sac though?
Yes, it sure does, it sure does. It's very important we have that sac, and I'm gonna explain why in a minute. So the pericardium is fibrous, it's tough, loose fitting. It has a serous pericardium, which is a parietal layer that lies inside the fibrous pericardium. Okay. The visceral layer is going to line what? We talked about this last semester. Visceral means organ, and it's going to line the actual heart. Okay, so the visceral layer is the epicardium. All of this, my nurses, would be epicardium. Okay, so you take the heart out of that pericardial sac, and now you have the epicardium, which is all of this. Pericardial space lies between the visceral and parietal layers and contains 10 to 15 milliliters of pericardial fluid. That is very important. What's that fluid do? It reduces friction. It reduces friction. Now, of course, in a pathology like congestive heart failure, then we have too much fluid, right? But I don't want you to confuse the two. We need about 10 to 15 milliliters of that pericardial fluid to reduce the friction. Functions of the heart, heart coverings is to provide protection against friction. Okay, so they're very, very important. So what is pericarditis? Yeah, it's inflammation of the pericardial sac, right? That's exactly what it is. If your patient has pericarditis, how would they present, do you think? Remember, it's inflammation of that sac that the heart lies in.
Chest tightness.
You got it. Chest tightness, what else? Chest pain, right?
Breath possibly.
Shortness of breath, right? It's actually very, very painful. And if they came into the ER with those symptoms, how are we going to treat them?
Heart attack.
We're gonna work them up as if they have a heart, they're having a heart attack, right? Only to find out later that it's pericarditis. How do you think we treat pericarditis?
Antibiotics.
You said antibiotics if we find an infection. But for the pain and the inflammation, what do you think we use really for the inflammation? Yeah, it's actually colchicine, which is the same drug we use for gout. Right, exactly. Yeah, and it works really well. We are usually not real concerned if someone has pericarditis because it's usually a one-time thing if they have it. However, if it's chronic, we try to figure out why it keeps happening because it could lead to other things, like a heart attack or some other cardiac issues. So then we begin to worry if it's chronic. Okay. So the wall of the heart is made up of 3 distinct layers. We already talked about the pericardial sac that the heart lies in. And I told you that epicardium covers this whole outside part, right? This is the epicardium. So that would be the outer layer or the most superficial layer, the epicardium. If we open the heart up, do you see all this? Does everyone see that? As a matter of fact, it may be easier if I showed you the picture. So, you see all this material here? I want you to think of muscle, okay? Because this is called the myocardium. The myocardium. So this is the muscular layer or the middle layer of the heart. All of this. And an endocardium is going to be the smooth area. All of this and the valves and, up here, that's all endocardium. And it's smooth because it allows the blood to flow without any restrictions. Okay. So, what's the deepest layer then?
Endocardium.
You got it, endocardium. Myocardium is the muscular middle layer, and epicardium is going to be the outside of the heart. Okay, I want you to know the three coverings. We okay so far? So far it's not too bad, right? Okay. All right, guys. So I want you to think of the heart as it has 4 chambers. It has 2 atria and 2 ventricles. 2 atria and 2 ventricles. The 2 atria are going to be on the top, and the 2 ventricles will be on the bottom. Okay, 2 atria on the top, bless you,
Thank you.
and the 2 ventricles on the bottom. I want you to know that the atria, and if we're talking about one, we say atrium. So we could say the left atrium, the right atrium. If we're talking about them both, it's plural, so we say atria. So the atria, I want you to know, are the receiving chambers. They receive the blood. And the ventricles are the pumping chambers. They're the pumping chambers. Ventricles are the pumping chambers. You want to write in your notes, and I'm sure you already know this. Blood flow of the heart should only flow in one direction. Right? It should only flow in one direction. If it does not, we have a problem, a big problem. Now, I also want you to keep in mind, because we're going to be talking about blood flow in a minute. So you want to always remember that yes, blood only flows in one direction, and that if the atria is receiving blood, right, and it starts to contract, the ventricles are relaxed because they have to be relaxed to receive that blood. If the ventricles are contracting, then the atria is relaxed. They both do not contract at the same time, okay? So if the atria is contracting, ventricles are relaxing. Ventricles are contracting, the atria is relaxed, okay? And we're going to talk about EKGs, and we're going to learn what happens in each wave. And you're going to see that. You're going to see that, like for instance, in the P wave, It's all about the atria contracting, and the ventricles are relaxing. Okay? So you're gonna see it again when we talk about EKGs. The myocardial wall of each atrium is not very thick because little pressure is needed to push the blood a short distance. And if we look at our picture again, here is your wall of your atria. You see how thin it is compared to your ventricles? Does everyone see that? Okay, again, it doesn't have to be very thick because it's just pumping blood into the ventricles. Okay, so the blood doesn't have that far to go, so the walls are thin. So for the ventricles, the walls are going to be bigger. The auricle, which is the ear-like flaps at the top of the heart, and let me go back and I'll show you the picture. Gotta go all the way there. This is the auricle. This is the right auricle, this is the left auricle. They refer to them as ear-like flaps. And this isn't in your PowerPoint, but I want you to know it. Okay, so you're gonna write this down. The function of the auricles is to allow the atria to expand when they fill up with blood. So that's the function of the auricles. Okay, so we've already talked about the four chambers, atria and ventricles. The right and left chambers are separated by the septum. So let's look at the picture. This is referred to as the interventricular septum. This is going to separate the chambers of the heart. Interventricular septum. So when you are dissecting today, and you make your incision, you're going to want to open the heart, cut the heart so when you open it up, it's like a book, right? And the first thing you're going to do, if you can find your interventricular septum, then you can worry about what side of the heart you're on, okay? So here, do you see the apex here? It's pointing to the left, so this would be the left side of the heart. And you see how thicker the wall is compared to the right side? Does everyone see that? So if we come over here, which side is the left? See, all they did, they cut this open, and it's like a book. So where's your left side of the heart? On your right. Here's your apex, so it's right here. Okay. And here's your interventricular septum. I'm going to point out some things for identification for exam number 5. But I will pin these actually on the sheet charts because you can see them really well. So the first thing I want you to know is these are referred to as papillary muscles. papillary muscles. And what's attached to them, they look like strings, right? Heart strings, right? But there's a name. They're called chordae tendineae. Chordae tendineae, heartstrings. And you see how they're anchored into the papillary muscle? Okay, we're gonna talk more about that in a minute. Looking at the ventricles, do you see these little ridges here in the ventricles? And I'll be able to show you more on the sheet part, but do you see those little ridges? That's referred to as trabeculae carinae. Trabeculae carinae. And it helps with blood flow. Okay, so trabeculae carinae. The last thing I want to point out is attached to these heartstrings are little flaps. Okay? This is what side of the heart?
The right side.
It's the right side of the heart. So these little flaps here are referred to as the tricuspid valve. The tricuspid valve. We say tri because they have 3 flaps. Okay, so it's the tricuspid valve. If we come over here to the left side of the heart, there's 2 flaps, and this is called the bicuspid valve. Or another name for bicuspid is mitral. So you want to put that in your notes because you can see it both ways. You want to know that the bicuspid valve is also the mitral valve. It's the same thing. And it's always on the left side. And the tricuspid valve is always on the right.
What was the name for it again?
Which one?
Mitral.
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 Bicuspid and mitral valve is the same thing.
You said the tricuspid is always on the right.
Yeah, tricuspid is always on the right side of the heart, and the mitral valve or bicuspid valve is always on the left. I'm going to show you 2 more valves. You know, the cool thing about this, we only have 4 valves in the heart. We have 2 atrioventricular valves, which are the tricuspid and the bicuspid. They're referred to as atrioventricular valves, and we'll talk about them in a minute. And we have 2 semilunar valves. One is the aortic semilunar valve, and one is the pulmonary semilunar valve. And you can see the aortic valve right here. You see it kind of looks like a cup, kinda? Okay. We're going to talk about the function in a minute of this aortic semilunar valve and the pulmonary semilunar valve. You can't see the pulmonary semilunar valve on the sheet parts at all. So you're not responsible for identifying them. But you will be responsible for identifying the aortic semilunar valve. And what's your landmark there? How are you going to find the aortic semilunar valve? Yeah. Right, it's right here. Here's your aorta, and here's your aortic semilunar valve.
Where's SL? Oh, similar. Okay.
Yeah.
I was gonna ask what SL.
Oh,
stands
what,
for.
yeah, no, that's okay. Okay. So now that you have a nice visual of these valves, now we're going to talk about the function of these valves, because these valves are what makes the blood flow in one direction. Okay? So, We have two atrioventricular valves. What are they? We just talked about them.
Foregut tenderness?
Yeah, tricuspid, which is on the right side of the heart, and the mitral or bicuspid valve, which is on the left. They're atrioventricular valves. Here's what their function is. You ready? It's to prevent blood from flowing back into the atria from the ventricles when the ventricles start to contract. Atrioventricular valves. So your tricuspid valve and your bicuspid valve, when the blood leaves the atria and it goes into the ventricles are going to start to contract. And when they do, the atrioventricular valves are going to pull up to prevent that blood from flowing back into the atria. And if we look at her picture, how is it able to do this? Because these valves have these chordae tendineae coming from them, and they're actually in those capillary muscles, right? So let's pretend that, oh, here we go, we'll use this. Let's pretend that this pointer is blood, okay? I'm in the left atrium. It goes through the bicuspid valve into the ventricle. But once that blood gets into the ventricle, it's going to start contracting, right? This valve is going to pull up, and it's able to do that because these chordae tendineae are anchored into the papillary muscles. So when they pull up, it's going to prevent the blood from going back into the atria. Okay? Does that make sense? You sure? Okay. It's a huge function. I mean, without these valves, obviously the heart would not work properly, right? Because the blood would be all over the place. All right. So that's the function of the atrioventricular valves. And you already know we have the tricuspid on the right, bicuspid, mitral on the left. Tricuspid has 3 flaps, bicuspid has 2 flaps. So the valves of the heart are mechanical devices that permit the flow of blood in one direction only. The AV valves regulate flow through the right atrioventricular opening. Okay, now let's talk about the 2 other valves, the semilunar valves. What are they called?
Aortic and
Aortic and pulmonary. So the semilunar valves are going to do just the opposite. When the blood is in the ventricles and the ventricles start contracting, well, the blood is going to leave the ventricles, right? So these semilunar valves will prevent the blood from flowing back into the ventricles from the aorta and the pulmonary trunk. So let's look at this. Let's look at a picture. So let's do the left side because it's much easier to see. So my pointer is blood, right? It's in the left ventricle. That left ventricle is going to start contracting, and it's going to send the blood through this aortic semilunar valve, which is right here, kind of looks like a cup, into the aorta. So once the blood is in the aorta, this aortic semilunar valve will prevent the blood from flowing back into the ventricle. Just remember that it's normal that you're going to have a little pool of blood in that semilunar valve, right? but that's all. It shouldn't be any more than that. And it will prevent that blood from flowing back into the ventricle.
Is that normal just for the aortic one, or is it normal for the pulmonary?
It's normal for the pulmonary. You're gonna have a little bit, because as you can see, it kind of looks like a cup. And I'll show you the aortic, centimeter aortic valve on the sheet part. And that's exactly what it looks like. It looks like a little cup. So you're always gonna have a little bit of residual blood in there. So we okay so far? This is huge, guys. I mean, I promise you I'm gonna touch you on the centimeter valves and the atrioventricular valves. You wanna know that the pulmonary valve is at the entrance of the pulmonary trunk. Okay? So that kind of gives you an idea about blood flow. So on the right side of the heart, when the blood leaves the ventricle, where do you think it's going to go? It's going to go through the pulmonary valve into the pulmonary trunk, right? Okay, so that already gives you a little bit of how the blood is going to flow. Aortic valve is at the entrance of the aorta. So that's easy, right? Aortic valve is at the entrance of the aorta. The pulmonary valve is at the entrance of the pulmonary trunk. And that makes sense because when blood goes through that pulmonary valve, it looks like a cup, right? It's gonna hold the blood so that it doesn't go back in to the ventricles. And then it'll go, carry on through the pulmonary trunk, and then we'll go from there with blood flow. We okay? All right. So skeleton of the heart. Set of connective rings that serve as semi-rigid support for heart valves and for attachments of cardiac muscle of the myocardium. We have an electrical barrier between the myocardium of the atria and that of the ventricles. Surface projection, general idea of relationship between the heart valves and the surface of the thorax. And I'll show you a picture in a minute. But first, flow of blood through the heart must be traced to understand functional anatomy. So for your quiz on Thursday, I'm going to have you write out blood flow of the heart as one of the questions. I'm doing this because it's only worth a point. If you miss it, it's not the end of the world, right? But on all your exams from here on out, your two essay questions are going to be cranial nerves and blood flow of the heart. What? Good job.
Just remembering all the vowels.
Oh, no, you're gonna be fine. I wouldn't make you do this if you didn't have to know it. I swear to you, you absolutely have to know it, right? And I find if I make you write it out, you won't forget it, okay? So, this is all you have to do. You always start with deoxygenated blood first, okay? The only change that I'm going to make here is that I want you to, at the top of this PowerPoint, I want you to put superior or inferior vena cava. I want you to put it at the very top. Superior or inferior vena cava. So again, we're going to start on the right side of the heart because that's deoxygenated blood. So here's what I want you to write. The inferior, superior or superior vena cava will deliver blood to the right atrium. Okay. And you don't have to do, I mean, you can write it just like this if you want with arrows. You just wanna know that superior or inferior vena cava will bring deoxygenated blood to the right atrium of the heart. From the right atrium, it's going to go through what valve, my nurses? The tricuspid valve. From the tricuspid valve, it's going to go to the ventricle. From the ventricle, the blood is going to go through what valve? The pulmonary semilunar valve. And you know this because where is the pulmonary semilunar valve located? At the entrance of the pulmonary trunk. So what's next? Pulmonary trunk. Blood is going to go through the pulmonary semilunar valve into the pulmonary trunk. From the pulmonary trunk, it's going to go through the pulmonary arteries. It's going to go through the lungs. And that blood is going to become what now? Oxygenated. So the pulmonary vein is going to carry oxygenated blood to the left atrium. The pulmonary vein is going to carry oxygenated blood to the left atrium. Now here's a nice rule of thumb for you. Remember that arteries carry blood away from the heart and veins carry blood to the heart, right? That's why you're never going to put here pulmonary artery, right? Because an artery will not carry blood to the heart, it's gonna carry it away from the heart. And you can remember artery starts with an A, and so does a lead. And you said there's one exception, what's that exception? We'll talk about it in a second, I don't wanna confuse right now. All right, so then we go to the left atrium, then what comes after the left atrium? The mitral valve. So the blood is going to go through the mitral valve into the left ventricle. From the left ventricle, it's going to go through the aortic semilunar valve, and then to the aorta, where it will be pumped systemically through the rest of the body. And then my nurses, it starts all over again with superior and inferior vena cava. 2, correct. Okay? Kind of, sorta? So what are you gonna start out first? Don't look at that, just tell me, like, what are you gonna write down first? Vena cava, excellent. And that's going to take the blood where? To the right atrium. Is it deoxygenated or oxygenated?
Deoxygenated.
Yes, so you wanna write that down. It's deoxygenated. And then where? Good. Through the tricuspid valve into the ventricle. Excellent. And then the ventricle is going to pump the blood to what valve? Pulmonary semilunar valve. And then it's going to go to the pulmonary trunk. And then the pulmonary arteries, right? It's going to go through the lungs, it's going to become oxygenated, and then that pulmonary vein is going to carry oxygenated blood to the left atrium. From the left atrium, it's going to go through the bicuspid valve, into the ventricle, through the aortic semilunar valve, and then into the aorta, and then it's gonna be pumped systemically throughout the entire body. That's why that aorta is so huge. It's one of the largest lumens we actually have in the body. It's huge.
I have a question about the essay question.
Yes.
Do we need to have goes through the lungs in there between pulmonary veins and arteries, or is it
You know,
good?
I would recommend it. I'm not gonna take off if you don't. It's kind of like cranial nerves. You want to be able to write down as much as you can, right? Because the more you know about the cranial nerves, the more you know about the blood flow of the heart and the small details, the easier it's going to be for you moving forward. Okay? You absolutely have to know this. I can't stress it enough. Okay? That's why I want you to write it out. And here's another way to study. Does anybody have a heart model? You may not just have one. You do? Okay. Well, if you don't have a heart model, this is what I recommend you do. You want to study with a few people. You want to take your pen or pencil and say, okay, if I'm blood, where did I just come from? Well, first of all, you have to know what side of the heart you're on. Right? You're on the right, because look at the small wall here. Okay? You're on the right side of the heart, so where did the blood just come from? Superior, inferior vena cava, right? And then you just take your pen or pencil and you go into these different chambers and you test each other, right? Don't cover these up somehow, don't use these. Because you want to learn what to look for if you're on the right or left side of the heart. Okay, that's the first thing you have to determine before you answer any of these questions. But this is how I'm going to ask for multiple choice. I'm going to say, the question will read something like, blood just entered the left atrium. Where did it just come from? Pulmonary vein. Okay. I'm gonna give you a sheet of paper, just like I always do. You can write it down. I want you to put your name on the paper down and hand it in to me. Any questions on this? Doesn't it make it easier though, learning blood flow when you know what these valves do? Because now you can kind of visualize that blood flowing through the heart and how the valves are working to make sure that blood only goes in one direction. Yeah, there you go. But when we get into the lab, I'll show you, it's a little easier with the sheet part. Okay. So this is showing you the surface projection. Again, we've already talked about this, but the base of the heart is at the top and the apex is at the bottom. It's going to rest on the diaphragm. This is going to be your right tricuspid valve. But I like it better. It looks better on the sheet part. Let's see, nothing there. So now we're going to talk about the electroconductivity of the heart. The first thing I want you to know is that the SA node is the pacemaker of the heart. The SA node is the pacemaker of the heart. So when I say pacemaker, what do you think then the function is of this SA node? It's going to do what? It's going to set the pace for the heart. right? So that it's beating at what? What should our hearts beat at? 60 to 100 beats per minute. If it's over 100, what's it called? Tachycardia. If it's under 60, what's it called? Bradycardia. Just know though, that some athletes, their heart rate will be lower, maybe 50.
Marathon runners too.
Marathon runners, yeah.
Football players.
It's always low? Yeah. And we're gonna have that, we're gonna have to, my heart rate since I was in high school is always 100. Or over 100, always. It's always been that way. We don't know why, it just is, so when I really get like, it goes to like 130, 140, yeah, and at that point, you gotta watch. Okay. So, conduction system of the heart, composed of 4 major structures. Okay, 4 major structures. We have the SA node, which is going to keep the heart beating at 60 to 100 beats per minute. And then we have the AV node. And I want you to know that we refer to the AV node as the gatekeeper. And it's going to keep the heart beating at 40 to 60 beats per minute. So it's referred to as the gatekeeper. And then we have the AV bundle of his. If somebody asked me, why can't it be, the bundle of her or she or, it's because the gentleman that, discovered this, his last name was his, H-I-S. So we have the AV bundle and the Purkinje fibers. And these two are going to keep the heart beating at 15 to 40 beats per minute. I want you to know these numbers, my nurses. Okay, so SA node 60 to 100, AV node 40 to 60, and Purkinje 15 to 40. This is the electroconductivity of the heart.
How much did you say for the bundle of?
Purkinje, it's a, they both kind of go hand in hand with that, but it's 15 to 40. So the system generates rhythmic impulses and distributes them to regions of the myocardium. So the body's electrical conduction system coordinates the heart contractions that produce the pumping cycle of the heart. The 4 heart chambers make up 2 pumps. The left pump moves blood systemically throughout the body, and the right pump moves blood through the pulmonary circulation so that blood can become oxygenated. So a little more information regarding that SA node, the pacemaker. It initiates each heartbeat and sets its pace. Specialized pacemaker cells in the node have an intrinsic rhythm. So sequence of cardiac stimulation. After generation by the SA node, each impulse travels through the muscle fibers of both the atria, and the atria begin to contract at that point. And here's a really nice visual on slide 30 of where these nodes are. So here we have the SA node, and look where it is. It's in the what? It's right here. What chamber of the heart is it in? The right atrium. The right atrium. And then that signal will travel down. And remember, it's all the myocardial, so it's the muscle. So it travels all through the myocardium. Here's your Purkinje fibers way over here. your patient needs a pacemaker, they actually will put it here. And they thread it through so that, you know, it's going to go into the right atrium, but they put it on the left side.
My daughter had not a pacemaker, but like a heart monitor, and it was placed right where the pacemaker goes.
They're real tiny now. So, which is quite amazing because they used to be big. And I don't know if you remember when you were a kid, like going into the 7-Eleven or a convenience store, and they had microwaves, and they would have these big signs saying, if you have a pacemaker, you know, you don't wanna be around the microwave. But they've made them a lot better now.
They're really cool.
And again, it's smaller, much smaller.
My grandfather still has one, and it's, I think it's got like about 5 years left on it, but he got it right when we started being able to move in like a year. So it's still on the bigger side, but it's just right now, like, he can be around the microwave, but if he's like removing this, like his off, and then he can't do any of that.
Yes,
He doesn't go through the specialist for it, and he's already had a lead come loose before, and he had to be rushed back into emergency. And you know, it's never that point where, like you see on TV a lot, where they dramatize, you know, having to hang upside down. He literally did it. They had to make him turn him upside down. Oh my goodness. To keep him from passing out.
Well, you know, my patient just got a pacemaker and, you know, they monitor it. So they called her in the middle of the night and said, I want you to come to the hospital, something's wrong. And she said, you know, that's scary enough.
Right.
But, yeah. But it is amazing what they do now. You know, we never had that technology before. Okay. Why don't we take a 10-minute break? So we'll come back at